All right, everybody, today we're going to look at the functional knee anatomy. So again, as I had talked about in the previous discussion on the hip, there's going to be a lot of crossover here. We have a lot of muscles that cross both the hip and the knee joint, and just again, make sure that you're noting the function of those. And a lot of actually the landmarks and everything we're going to be discussing for the most part have been discussed already. So really in the knee, there's not going to be a whole lot of new things. There obviously some of the new things will consist of some of the other soft tissue structures around the knee, like the various knee ligaments we obviously didn't get into at the hip, but we will be discussing those as well with a lot of the other information we've previously looked at. Okay, so again, just to review where we're at. Okay, so now we're down at the knee, and again, a lot of the pertinent anatomy that we're going to discuss has already been kind of touched on a bit. We're just going to focus here now, obviously, more at the knee joint and some of the particular structures that kind of center around what it is we're looking at. Now, as was previously discussed, we have 7 two-joint muscles. One have an action at the hip and the other have action at the knee. I am actually going to be posting a discussion board. And in the discussion board, I want each of you to list the 7 two-joint muscles. Okay, so it'll be a discussion board post. Go in, post it right in the section where you could submit it in, and submit the 7 two-joint muscles. Okay, one have action at the hip and another at the knee, so that's something to consider. Some of them do the same action at the hip and the knee, some of them do different actions. Okay, so one, be mindful of that again as you're kind of going through and reviewing this concept, to make sure that you don't confuse what the actions are at the hip and the knee. Okay, so make sure that you know what the two functions are at each of the individual joints. And we're going to be discussing that here. We're going to be obviously talking about those muscles, but I want you to just list the 7 two-joint muscles. Okay, so again, looking at our lower extremity, this was the slide we showed in the previous discussion. Here, we're going to be looking at specifically the structures down a little more distal at the knee. So down in this region right down here is what we're kind of focusing in on. So again, here we have an anterior view. So again, as I keep saying, make sure you know how to recognize the anterior surface versus the posterior surface, okay? That's an important thing. So then you know what landmarks that you're looking at. So down here, so we have the anterior and the posterior. If we're looking down here, okay, you can see the pertinent anatomical landmarks on each side. Okay, and again, take a look in your textbook. We'll have some closer, some close-ups of these, and we'll show them from some different angles. But again, know whether you're looking at the anterior or the posterior surface, and then that kind of tells you where you're going to be at with your different anatomical landmarks. Okay, so the knee joint itself, as we kind of talked about this already, again, a lot of this stuff is going to be repeat from what we've previously discussed. It is primarily a hinge joint. Now, we said it's primarily a hinge joint because, unlike a classic hinge joint, or as I referred to it in class as a modified hinge joint, it does additional movements that most hinge joints wouldn't do. So for instance, if you look up at the elbow, kind of I guess the classic example of a hinge joint, the elbow does flexion extension in the sagittal plane. The knee joint will do that as well. However, the knee joint, in addition to doing flexion and extension, will also do rotation. Okay, so the caveat to that is that the knee has to be flexed in order to be able to actively rotate the lower leg. Okay, so in other words, you can't rotate if you fully extend your knee and you rotate your leg or turn your foot in and out. At that point, you're not just rotating the lower leg at the knee. What you're basically doing is rotating the hip. So as we kind of look, and this picture is kind of nice because it really kind of breaks down what you're looking at and separating the knee. So the enlarged femoral condyles articulate on the enlarged tibial plateaus. So here's the the condyles. Okay, again, make sure when you're looking at these pictures, you differentiate between the condyles and the epicondyles. Okay, there's a clear demarcation for when you're looking at the condyles versus the epicondyles. So if you look here, now obviously here we're looking at a posterior view. We're looking at a posterior view of the knee. You can see the condyles. So see how the condyles are kind of just like, I guess more or less, for lack of a better comparison, the smooth part. And then what's the epicondyle? The epicondyle is the area right above that. So here's the anterior side, okay? So you can see where the condyles are and where the epicondyles are, okay? So that's an important distinction. What isn't actually talked about on this picture, because this is another landmark that students sometimes tend to get confused with, is right above the medial epicondyle, right in here, it's not labeled on the picture, is something called the adductor tubercle. Okay, it's right up in here where the pointer is. And that landmark, sometimes students kind of get confused with the demarcation point. So make sure you're looking at this and you could kind of recognize the difference between particularly the condyle and the epicondyle, but then also the medial epicondyle and the adductor tubercle. Okay, so and if you look at the other articular surface, the medial and lateral tibial plateaus, they will receive the femoral condyles. We'll talk about some of the other soft tissue structures that help to stabilize the knee as well. The tibia, as we already talked about, is the medial and is going to bear most of the weight. Okay, so the tibia is the much larger bone of the lower leg, and that bears most of the weight. So the fibula is going to be the lateral bone. It's the smaller lateral bone that was on the picture. It serves as an attachment for knee joint structures. It does not articulate with the femur or the patella. So it's kind of a part of the entire complex because of the fact that you have ligaments and things of that nature that will attach to it, but it doesn't actually, it's not actually part of the knee joint, okay? It's kind of part of the knee complex, I guess, if you will, because of the fact it does have some, soft tissue relevance because of what attaches there. And there's really not a whole lot of weight bearing. Again, it's kind of debated how much weight the fibula really bears, but it's minimal. So it's not, well, I wouldn't go as far as say it's completely non-weight bearing, but it's minimal weight that it bears. When you look at the patella, so the patella is a sesamoid bone. Again, we've talked about the patella already. If you look at the picture up here, so again, it's a sesamoid bone. It kind of is embedded in the quadriceps and patellar tendon. So the way we kind of break this down, the quadriceps tendon is the part of the tendon that's superior to the patella, and then the patellar tendon we consider the part that's inferior to the patella, okay? Some textbooks, and you can see even in this picture, if you look closely, it's a little small on the screen, but if you do look closely, or you look at the note slides as you're given, they actually just call the whole thing the patellar tendon, and that's not unusual, but you should be able to differentiate between what is considered the quadriceps and the patellar tendon. And the idea with it is it serves as a pulley. It improves the angle of pull and gives the knee a greater mechanical advantage. So essentially, if the patella wasn't here, if the tendon just kind of sat flat right against the joint, what would happen is you wouldn't have as much leverage. You'd still be able to extend the knee, but you wouldn't get you wouldn't have as much strength in knee extension. So by this bone being in here, it pushes the tendon away from the joint, which actually increases the leverage and makes knee extension much stronger. Okay, so we're going to look at some of the bones. Again, a lot of these we've kind of talked about already. So some of these slides actually are very familiar or very similar to what we've looked at previously. All right, so if we look at the femur, again, be able to differentiate between the condyles and the epicondyles. Okay, so here we're looking at the medial and lateral condyles. Okay, again, also make sure to know whether you're looking at the medial or lateral side. Here's the medial condyle. Here's the lateral condyle. The epicondyle is right above them. Okay, so think about another way you can tell what's the medial side versus the lateral side. So just think to yourself right now, well, how can you tell the difference between the medial and lateral side of the knee? Or what's the dead giveaway? Look for this. Fibula, right? So you look for the fibula. The fibula tells you whether you're looking at the lateral side. And a lot of times physicians, when they're kind of orientating themselves to an MRI, they'll actually do that. They'll look for the fibula, and the fibula tells them kind of what it is they're looking at sometimes. So look for the fibula. You can tell the medial versus the lateral side. Okay. Now the adductor tubercle, again, was one that's talked about. So we don't show the epicondyles on this list. The adductor tubercle is right up in this region here. Okay. So that's an important thing to know. Okay. Then obviously you have the patella. For the tibia, you have the medial and lateral plateaus. You have the tibial tuberosity. So the tibial tuberosity is this kind of projection right here in the front. Gerdy's tubercle and the pes anserine group we've already talked about. So here's your pes anserine. It's on the, Gerdy's tubercle rather. This is Gerdy's tubercle on the anterior and lateral side. And then you have the pes anserine group right here. So think back. I'm not going to give the answer right now, but think back, and these are some things you should be reflecting on as you're kind of actively going through these talks. What are the structures that attach to those two areas? Because there's important structures that attach to both of those. So again, go back, and if you don't know that off the top of your head at this point, make sure you go back and review it. All right. And then the last one we have up here is the fibular head, which is the proximal end. Make sure, and I'm going to be giving pictures of anatomical models for the time being, but you should be able to differentiate between the head of the fibula and the distal end, which is called the lateral malleolus. So you have to be able to do that. And they do look distinctively different, by the way. So make sure you can differentiate between the head of the fibula and its distal end. Okay, posterior view. Okay, again, make sure that you can know the posterior view. You have the medial and lateral condyles. You have the adductor tubercle, which we already talked about. You have the lateral and medial plateaus. You have the posterior medial tibial flare in this region, and again we have the head of the fibula. So again, these are some of the important bony landmarks as you're going through here, so make note of these and make sure that you could identify them. Okay, the medial aspect. Okay, if we're looking at the medial aspect of the knee. All right, so again, here we have, now again, how could you tell this is the medial aspect? Well, there's no fibula, so the fibula is over here. Okay, so you can tell that there's no fibula. So just looking at this picture, if I said, well, is this a medial or a lateral view? You should be knowing that it's a medial view. Okay, so you have again, the medial condyle, okay, of both you have them on the femur. You also have the medial tibial condyle along with the plateau. So the plateau is the top part. The condyle is the actual part on the end here. Okay. You're going to have the pes anserine. Again, make sure that you know. Again, you should, if you don't know what structures are in the pes anserine group, make sure to go back and review that right after this discussion. Okay, if we look at the lateral side here, now you can see again, how do we denote it's the lateral side? Well, right away you can tell there's the fibula. Okay, so if the fibula is in the picture right away, there you see that it's the lateral side. And again, I'm going to skip around a little bit here, but again, fibular head, make sure when you start to look at pictures of the fibula, you can tell the difference between the proximal and the distal fibula. Okay, and again, here you have, again, your other lateral structures that you would see from a bony perspective. Again, Gerdy's tubercle. What is the structure that comes down and inserts at Gerdy's tubercle? Again, if you don't know that, that should be something that you go back and review immediately after this discussion.